Hello, I'm Dr. Hassaan Tohid, and I am here once again with an amazing topic, as usual, observational studies. What are observational studies? This is one of those questions that bothers many scientists, many new students who just want to learn about research. But when they hear these terminologies, observational studies, clinical trials, they are scared of these terminologies. But after this video, you will not be scared of this terminology anymore because I will do my best to make sure I make things easier for you. So what are observational studies? Let's begin. In order to understand observational studies, we need to understand that in research world, we have different kinds of studies. For example, when animals are involved, we call them animal studies, right? When test tube is involved, we call them in vitro test tube research. When we study one person, we call that case study. When we have one group, we call that a case series. Then comes the observational studies. But observational studies are further of three types. They are not just one kind of study. There are three different subtypes of observational studies. And as the name suggests, in observational studies, we just observe. The scientist will just observe. The scientist will not intervene, will not give anything to the participant or patient or a subject. The scientist will not manipulate the environment. The scientist has to just observe the population and take the report, take the information, and then report it and then publish it. This is what an observational study is. And in all three kinds of observational studies, we do the same thing, but in a different way. And we'll talk about that in this video. Now, observational studies are different from clinical trials. Clinical trials are also known as interventional studies or experiments. In clinical trials, the scientist gives a medication to the patients or gives an intervention to the patients or participants. This intervention doesn't have to be a medication. It can be anything. So whenever the participants are given something by the scientist, that means the scientist is manipulating the environment or is giving something to the patient or is asking the patients or the participants to do something and observing the effects of that command. So that means that the scientist actually has manipulated the environment and now looking at the after effects of that manipulation, then it is a clinical trial. In clinical trial, what can they give? A medication, an injection, a vaccine, exercise. They can ask the patient to do exercise and they record the findings of that exercise. Now, in the observational studies, the scientist does not ask the patients to do exercise. The scientist will already just select those people who are, for example, doing exercises, and he will just observe them. That's the difference. You see, you understand the difference? That in observational studies, the scientist will just observe, but in clinical trials, the scientist will intervene and manipulate the environment. For example, in clinical trial, let's say the scientist is observing the effects of walking on blood circulation. So he will ask the patients to walk. Once they walk, then he will record the findings of the blood circulation. But in the observational study, the scientist will not ask the population or the patients to walk. He will just observe people who are already walking. I hope this makes sense and you understand the concept. We will definitely go deeper in other videos, and I make sure that I explain it in more detail in other videos. But now let's stick with observational studies. So what are observational studies? In order to understand what observational studies are, we need to understand a concept. And what is that concept? Let me give you an example. If you have watched the video or a movie called Back to the Future, it's a famous Hollywood movie by Steven Spielberg. It came in 1985, I guess, and this was a very famous movie. and the hero, the main character, was Michael J. Fox, very, very famous actor. So, what that movie was all about. If you understand that movie, it will be very easy for you to understand observational studies. Now, you will say, what does that mean? How is this possible? Let me give you an example. In that movie, Back to the Future, what happened? They have a time machine, a car that is actually a time machine. And they sit in the time machine, and sometimes they go into the past, and sometimes they go into the future. They go into the past, they go into the future. Past, present, future. They are in 1985. That's why I remember it was in 1985, because in the movie they showed the year 1985. So they sometimes go to year 2015, and sometimes they go to the year 1955. So that's why they went from present, past to future, and that was the movie all about. And if you haven't watched it and you watch it, then you will understand what I'm talking about. Now, what happens in observational studies? Observational studies are not too different. In observational studies, in some observational studies, you remain in the present. What is happening right now? In some studies, you go into the past, just like Back to the Future. And in some observational studies, you go into the future. Now, let's talk about this. So, observational studies are of three types: cross-sectional study, case-controlled studies, and cohort studies. These are main three types of observational studies. So, in cross-sectional studies, the scientist looks at a population at one point in time. That means what is happening right now? What is happening today? What is happening right now? So present, just for the sake of discussion, consider it as present. Now, the second ones are case control. In case control studies, the scientist goes into the past. You will go into the past and look at the past of the patients. For example, 1981, 1979, instead of 2021. Now, the third kind is cohort studies. And in cohort studies, you go into the future, 2050, 2060, 2061. You go into the future. But yes, there are two kinds of cohort studies. I know, wait, I know there are some people who would say that, what is he talking about? There are two kinds of cohort studies. There is a cohort study in which you go into the past. Yes, that's correct. And I was coming to that. So there are two kinds of cohort studies: prospective cohort, in which you go into the future; retrospective cohort, in which you go into the past. So now these are the three different kinds of cohort observational studies. Now let's talk about all of these study designs to understand the difference between these three. So in cross-sectional study, they usually are survey studies. The scientist distributes the survey or just ask questions to a population, just looking at them and asking questions. What exactly they are doing, what is their behavior, or just observing and taking notes and getting an idea of what this population is doing. So this is actually a survey study, a cross-sectional study in which you remain at one point in time. They are also known as prevalence studies. You are actually studying the prevalence of a problem or a disease or whatever you are studying. And they're also known as snapshots. Snapshots, yes. So these are cross-sectional studies, and they are usually descriptive in nature, because usually we don't have a control group. Now, listen to my words again. Usually there are no control groups. There's only one group. But there are cross-sectional studies. People have done those kinds of cross-sectional studies in which they had two groups. That's strange, but yes, there have been studies. So don't ever think that cross-sectional study will always have one group. They can have two groups as well. The main thing is that you just observe. You just observe and you take readings of what is happening at one point in time. That's cross-sectional. Now, the second kind is case control. So what is a case control study? In case control studies, the scientist goes into the future. In case control study, the scientist goes into the past. So what does that mean? How does he go into the past? How does the scientist go into the past? The scientist goes into the past by looking at the documents, the electronic medical records, clinical records, computer, or taking history, asking questions, asking family members, asking the doctor, asking the patient. If it's a clinical case control study, or it could be in any other field too. But the main goal is that you go into the past, you look at the previous records. So what exactly are you doing? Of course, usually it is done in healthcare setting. So you actually are studying a disease, but you go into the past and look at a risk factor. But what you do is, let's say you are in a hospital and you are studying a disease, let's say multiple sclerosis. Now you will select a population in the hospital, one group with multiple sclerosis in one hospital, and the second group with no multiple sclerosis. Now you have two groups. Let's say you have 20 people, 20 with multiple sclerosis, 20 without multiple sclerosis. Now you will look at the documents of both of these people. And you go into their past and you see, were they exposed to any risk factor in the past? So you check the records and you find out that, okay, the population that has multiple sclerosis was exposed to XYZ risk factor. So you can say that, okay, this risk factor is associated with multiple sclerosis. And we can, or we can take an example of lung cancer and smoking, the most common example in case control, right? That you have lung cancer patients. So you have a ward. Now you have other patients with no lung cancer or other kinds of lung disease, but one group is of lung cancer. Now you will look at the past record of both kinds of patients, the control groups and the cases. Yes, the cases are the patients with the disease. The control groups have no lung cancer or some other kind of disease related to lung. So now you will look at the records and you will find out how many of them were smokers. And you find out that, okay, majority of the patients with lung cancer, 15 out of 20 actually smoked. So and the remaining only 2 smoked. So you can say it is clear that smoking could be a risk factor for lung cancer. So this is how case control study is done. Always there will be 2 groups, one with the disease, one without the disease that you are studying. And the sample size, the selection of the sample is based on the outcome. The population is selected is based on the outcome. That means you already know the disease that you are studying. You already know the disease that you are studying. This is the key point. And I'll explain why. But when we talk about cohort study, then we'll talk about this. Now let's move to the cohort studies. Now, as I said before, cohort studies are of 2 types. Now, cohort studies are actually the harm studies, in which you study the risk factor. In case control, you actually were focused on the disease, but here you study the risk factor. So what is a cohort study? First of all, we need to understand what is a cohort. Cohort is a big group of people with similar characteristics. For example, people living in one locality, people living in one town, one country with similar characteristics, and they are exposed to a similar risk factor. For example, people living in Japan where there was a nuclear explosion in World War II. So now you have taken the population in Hiroshima, Japan, where the nuclear bomb was exploded. Now you will study, what you will do is you will look at this population and you will go into their future. And we're talking about the most common kind of cohort study, the prospective cohort, right? The most famous one amongst the new scientists. Cohort study, the prospective. So what you will do is you will look at this population next year, 5 years down the line, 10 years down the line, 15 years down the line. So cohort studies can be very, very long. There are some cohort studies that are still going on. Birmingham study started in 1948 and it still is going on. So many other studies. 3 generations have passed and the study is still going on. So the cohort actually becomes bigger and bigger and bigger. So Hiroshima, for example, is a very good population to study and do a cohort study, because they already have a risk factor out there. The atomic explosion happened there. Now, what is happening to that population? They can do a cohort study and observe, and in the future, they will have an idea. Did majority of them or a big percentage of them develop certain kind of cancers, certain kind of skin problems, certain kinds of problems that nobody else had? Do they have some kind of unique disease? So this can give an idea that yes, in Hiroshima, Japan, because of the risk factor, this risk factor is associated with this kind of cancer. This is how they can come up with the association, that this risk factor is associated with this disease. Now, another thing that we need to remember, in cohort studies, we again have 2 groups. just like case control. But here we have two groups that are exposed and unexposed group. So we will take two group of people, similar characteristics. So one with risk factors, the other one without risk factors. So let's say we take a similar population, one from Hiroshima and one from another city, and then we followed them up, and we can say, okay, so people in Hiroshima, they develop XYZ cancer or XYZ skin problem. So we can say, yes, there's a risk factor. Or let's change an example. Let's say there is a locality in which there is poisonous water. So we divide that population into two groups, exposed versus unexposed. Exposed are those who drink water from that lake, the poisonous lake, and those who don't drink water from that poisonous lake. Now we observe them next year, 5 years down the line, 10 years down the line, and we can find out if there is any disease that was developed in those people who were drinking that water. So this is a cohort study. You're just observing. You are not intervening. You are doing a risk factor study. So you are studying a risk factor. And now let's talk about the other kind of cohort study, the most challenging one for many students. And that is the retrospective study, in which you go into the past, So what is a retrospective cohort study? So retrospective cohort study is the same thing, just go from backwards to the beginning of the same prospective cohort. Let's say the study has already happened, and now you start the study again, and the disease has already happened. When you are starting the study, the disease has already happened in the retrospective cohort. In prospective, you started when there was no disease. When there was no disease, you started that cohort study and you followed them up, and the disease were developed in front of you, in front of your presence and in front of your eyes. You saw the disease develop. But in retrospective cohort, the disease has already developed. You are starting it later when the cohort study is already been done, for example. So now you will go into their past and you check the records, and you will see what kind of risk factor they were exposed to. So the risk factor has already been done and the disease has already been done, but you still don't know the disease. You just know the risk factor in that locality. You still don't know what disease has happened. You have started the experiment, the disease has happened, but you don't know what disease has happened. You just know about the risk factor. So you will go into the past and you will look at the records and ask questions, and you will have a whole report of what happened, what kind of risk factor this population was exposed to, and there was another population that was not exposed to any risk factor. And then now you find out that, okay, some of them have died, some of them are still alive, and those who are alive, they have this kind of disease. So you can say that, okay, this risk factor is somehow associated with this disease. So retrospective cohort is when you go into the past. Prospective study is when you go into the future. So now I hope the problem is resolved. Now we understand prospective cohort, retrospective cohort. Now the question is, do we calculate the relative risk ratio and odds ratio? So remember, in case control study, we just calculate the odds ratio. In cohort studies, we calculate the relative risk, but we can also calculate odds ratio. But odds ratio alone will only be in case control study. So these are the three kinds of studies. I hope you understand it. Now, one more thing is, in both studies, in case control, you went into the past, and in retrospective cohort, you went into the past. So what is the difference? Remember, in case control, you knew the disease. In retrospective cohort, you did not know the disease. So remember this difference. This difference is enough for now for all those who are just beginning their careers in research. I hope this video was really, really interesting, and I hope you understand and you learn what are observational studies. Let me give a quick revision that observational studies are study designs, and there are three kinds of observational studies: cross-sectional studies, case control studies, cohort studies. And cohort studies are further of two types. The cohort studies are of further two types: prospective cohort and retrospective cohort. In cross-sectional study, we look at what is happening at one point in time, let's say present time. In case control study, we go into the past, and we start with the disease. We know the disease. The selection of the patients is based on the outcome. That means the disease. In cohort study, the selection is based on the similarity of the group and sometimes the risk factor. So you don't know the disease in cohort studies, whether prospective, whether retrospective. So in prospective cohort, you go into the future. In prospective cohort, you go into the future and you see if they develop any disease. Now, disease will be developed later. But in retrospective cohort, you go into the past, you study the risk factor, but the disease has already been developed when you started your study. But you don't know what disease it was. So now you will find out what disease was developed. So remember these three kinds of observational studies. Watch this video again, take notes, and if you have any question, comment below. I'll come back to you and answer as soon as I can. Thank you. Keep learning. Keep watching.